Okay, so in this video, I will be doing assisting with amniotomy. The reason to do this is the baby loses fluid around the head. It'll make the baby fall into the cervix and make the contractions come frequently and forcefully. Also, if you can't keep the fetal heart rate on the monitor, you can put electrodes on. So this is why this procedure is done. I would explain that the reasons why we're doing the procedures, as well explain to the patient what's going to occur within the procedure. Then I would ask the doctor for his size gloves, and I would get 2 pair of sterile gloves and bring them in the room and have them ready. To get the patient ready, I would put her in dorsal recumbent position and put chucks under the patient. Okay, so then when the doctor comes in, the doctor will say that he's going to get ready to do the procedure. So I would have a sterile amni hook that I would open up and give to the doctor. Once the doctor is about to perform the procedure, I would say to the patient to take a deep breath, and the doctor will reach in and pop the bag, or what they call snag the bag, and then once but before he do it, he's gonna put on the sterile gloves to do it, and then after he do it, when the fluid is coming out, you want to examine the fluid for the color. If it's a brown tinge color, you want to notify the doctor. You also want to monitor the patient, the fetal monitoring for the first minute to make sure any decelerations occur, because that might mean the baby's in distress. And yeah, you want to you also want to check the color to make sure that you check the color because the baby has the first bowel movement, and that shows the signs of distress. You also want to check the patient frequently check the patient frequently, come back, check the patient frequently, and check the fetal monitoring frequently. You also want to check the patient's temperature every 2 hours. Once all the fluids has came out, you want to clean the patient up. You want to change the patient chucks, and you also want to cover the patient. And if the patient wants to walk around, you want to try and keep them on the monitors. Some facilities have monitors that you can walk around with. I think that's it. And yeah, that completes the assisting with the amniotomy.